because I didn't plan on flying over this week and bringing someone or using you.
All right. So hi, Shelly. This is Amber. And
Hi.
Amber is a PTA student and is thinking about doing Gateway course. And so I thought this would be a really good way for her to get a little exposure to Gateway, as well as for me to communicate to you some of the things that she would need to be learning anyway. So, Amber, anything I need to know about your body, just in terms of injuries or current pain or issues that are just relevant for movement?
No, probably a stiff neck from sitting and studying a lot.
Okay, all
I
right.
do probably have a stiff neck.
So that's probably not going to be something that interferes, but we can definitely prop you, and
Right.
we'll be looking at that. Okay. So I'm going to have you start laying down in
Okay.
what we call a supine position, as I'm sure you're aware. And I think, Shelly, you can see pretty good here. So as we're looking at body position, we want to find a nice organized alignment. And I'm going to have you bend your knees. And as you think of where your body is being used for Pilates or any movement for that matter, what we're trying to do is help to facilitate good, easeful movement.
Mm-hmm.
All right? So if you were to think about your skeleton laying down,
Mm-hmm.
all right, and have the weight of your head, your rib cage, and your pelvis, and then your feet just lined up in line with your sits bones right below it.
Mm-hmm.
I want you to feel how your breathing helps to either ease that position or cause strain in that. And different people are going to experience that differently. So
Okay.
go ahead and take an inhale, and then exhale, letting your body settle into that skeleton. And again, your neck looks like it looks pretty good. Can you drop your chin just a little bit?
Should I take this off? Maybe the hood is in the way.
Yeah. And if you need to move your ponytail, we can do that too. So we're just trying to find an easeful place for your head to rest in relation to your rib cage. That looks pretty good. And again, we're not trying to cause tension through that neck. And do you mind if I touch you?
No, yeah, I'm fine.
Okay.
Mm-hmm.
And we're not trying to cause any excess tension through that low back or hip.
Okay.
And as you inhale, I want you to feel the expansion of your ribs, and then exhale, let it settle. Good. And continue that movement. And inhaling and exhaling. Good. And as you continue to breathe, you might find that there's places that you might be able to rest better. And I'm just going to give you a little prop in your head, and you can tell me if that feels easier or not. Go ahead and raise your head. Does that feel any easier? All right. So as we inhale and exhale, I want you to just start to feel what movement occurs in your body. And if I had you bring your hand on your chest and your other hand on your rib and your belly, I want you to feel that breath being able to move up and down your spine. And you don't look like you have a lot of excess breathing in your neck, but you do seem to kind of draw it up.
Mm-hmm.
See if you can let it move through the spine, not just up into that head, neck, and shoulder area. And let the belly go. You don't need to hold it. Good. Nice. And letting it go again. So you start to feel that pressure or tension moving through your system. And we want to have that diaphragmatic breathing expand and open through that rib cage and feel the movement on the back side as well as the top side and the sides of your body. And that's part of breathing, all right? As we keep that movement in your spine and movement in your ribs, that allows you to move outside here too, okay? With your transverse abdominis, that's going to help to give your spine and your pelvis some stability. And if we were to lengthen through that spine by just dropping your chin slightly and reaching your sits bones in opposition to my hand. And exhale, drawing those ribs down. Good. And you feel a little extra stability through your spine and your core. So you might feel a little bit of work, but still have the ability to breathe. That's what we're looking for. So there's not a lot of tension in your low back, but you feel that stability out through your spine, okay? So let's start to let that breath move through your pelvis. So go ahead and you can take your hands to the sides of your body. And another cue that we just kind of want to be aware of is the openness through the clavicle. So if you feel a little tension, you could feel that kind of curling in and adding strain to the front of your body. Sometimes palms up helps to open up. Sometimes it lifts through that thoracic spine and kind of pulls you up. So just find that easy place where you can move. You can see if your palms down or even thumbs up, wherever it feels easier for you to lay.
I think I tend to roll in more anyway.
And I think a lot of women do, okay? So if we were to have you start to inhale, allow your tailbone to find the mat. And then exhale, feel your pelvis just start to roll up towards your waist with as little muscular strain or effort as possible. And again, we're trying to just allow the pelvis to do the moving. So if your hip was on a wheel, and you were to inhale, let the wheel roll away from you. And then exhale, let that wheel roll back towards your waist. Good. And then inhale, let it go. And then exhale. Good. And just let the rest of your body move with it, but not fight with it. Does that make sense? So we're not wanting to initiate the movement through your spine extenders, but rather through the pelvis. So I'm going to give you just a little assistance here. So feel those ASIS roll forward and then exhale back. Good. How's that feeling? Again, as little muscle effort as possible. Good. And one more time. And staying here, just bring it back a little bit and find that place where it's kind of in between. Does that make sense? Okay. So does that find an easier place for your ribs to be?
In the middle?
Okay. So now I want you to just move your pelvis away from your ribs. Okay.
The ribs pop up.
It wants to, doesn't
Yeah.
it? All right. And I don't mind some of that, just so long as you don't move from the back.
Oh, okay.
Does that make sense? And then as you curl your pelvis back up towards your waist, you can kind of feel how your body kind of flexes. Okay. I want you to take an inhale, feel the breath behind you. So that's your exhale. Inhale, feel your back. Good. Exhale. Good. Now feel your back as you inhale. And then exhale. Now, inhale, but let your pelvis roll forward, still feeling your back. And exhale, curl it back up. Does that help to lessen some of that pull? Inhale, let your pelvis roll forward. And then exhale, let your pelvis roll back. Good. So we're trying to get a little disassociation of that pelvis. There we go. Does that feel a little bit lighter? And curl back up. Good. And one more time. And curl back up. Good. So find neutral again, wherever that is. Okay? Yeah. You could rest that a little bit lower. Good. Now, from here, we're going to start to peel the pelvis up a little bit, kind of exaggerate that movement. You were getting a little bit of sway with the breath and that pelvic curling back and forth, but let's see if we can just help your body move a little bit more.
Okay.
All right? So, we're going to take an inhale. Feel your sits bones reaching in opposition to the crown of your head.
I'm gonna listen
So,
up.
nope, just
Oh.
let your body stay there rested. And kind of feel where your pelvis, your rib cage, your shoulders, your head all kind of align. Good. Good. Does that feel nice?
You have to sink.
Yeah,
You have
you
to
do
like,
have to let it sink a little bit.
Yeah.
Good, that looks good. Now, I'm going to have you exhale, curling your pelvis up towards your waist. Okay? And then continue to let that pelvis curl up. Put some weight in your feet. And then lift your hips up with those legs. Good. I'm going to have you inhale into my hand and exhale, let it drop down. Good. All the way down to your tailbone. That felt kind of good. Okay. So inhale, allow your pelvis to roll, and exhale, continue to peel up. Good. Widen through the back and your shoulders. And then exhale, just follow my fingers. Good. Feeling better? Let your pelvis roll back. Exhale and come up. There's a little stiffness that wants to happen through here. Okay? So let's just slow it down a little as you exhale, roll to here. Inhale, still maintain the length of your neck. And continue to roll your pelvis all the way down. Inhale forward. Exhale, curl back to your waist and your ribs. Good. Press into your feet as you start to peel up. That was better. How did that feel?
Yeah, different.
Widen through those shoulders. Lengthen through the back of that neck. I'm going to suggest one other thing. Bring your feet in just a little closer. Let that pelvis rest. Good. Inhale, roll forward. Exhale, curl back. Press into those feet to peel the pelvis up. Good. A little stiff through there, but we're going to just let it melt. There we go. It's easier to melt coming
It
out,
is.
isn't it?
Yeah.
And let's just do one more. Letting your pelvis roll forward. Let it roll back. Yep. That was the best one you did. What did you do different?
Concentrate on moving one segment at a time.
Perfect. So that's that axial elongation with articulation.
Okay.
So instead of having it be really holding and gripping, which is part of what we sometimes think is axial elongation,
Yeah.
we need that flow in there,
Right.
that movement through there,
Right.
and maintain that axial elongation.
Right. It wants to come up all at once.
Yes. And part of that is habit
Mm-hmm.
and stiffness in certain segments.
Yeah.
And that's all right too. It's just trying to figure out how to undo it,
Yeah.
unwind it. Okay? Did that feel better?
Yes.
Okay?
Yeah.
So, spinal articulation
Okay.
with that neutral. And how does it feel now that you're back on the mat in terms of where your ribs are and in terms of where your pelvis is?
Good.
Okay? Not as stiff maybe through
Mm-mm.
some of that area?
Yeah.
Okay. So we're going to take your hands behind your head. And I want to just give you a little awareness of your head, neck, and shoulders.
Okay.
Okay? So if I had you draw your elbows up just slightly, can you feel the width of your shoulders and still those ribs on the mat? Okay? So if you lower the elbows down, you feel how it kind of lifts up. And then if you raise them up just enough to give the shoulder support and give your head a little lift.
Right.
Okay? Ribs, we're still trying to find the base of the ribs. So if you thought about where your ribs are laying on the mat, there's probably places that it's easier to find,
Mm-hmm.
and then there's places that maybe require a little bit more effort
Mm-hmm.
to find them. We're trying to find that neutral weight in your pelvis, heavy weight in your ribs, in your head, and then only recruit the muscles to just try to keep that in that position.
Okay.
Okay? So if I had you start to peel your head up as if you had wheels in your ears.
Mm-hmm.
Nice. And continue to peel your spine as if it was on a piece of sticky tape. Right to about there. Did anything change in your pelvis?
Not that I think.
Okay,
Maybe the weight dropped a little bit more onto my.
Low back?
Yeah.
Okay, see if we can roll back down. And this time, having again a sense of the weight of your pelvis in neutral.
Okay.
Because remember we talked about that ASIS, and we want to just have that in the center, not
Okay.
curled back, not curled forward.
Okay.
Okay, just heavy through the center. So you kind of have, if you had a flashlight on the front of your hips,
Okay.
they'd be shining straight up towards the ceiling.
Okay.
And there's a little bit of space through your waist, but then those ribs are trying to find them out again.
Okay.
You feel that little bit of
Yeah.
core control. And you still have a little bit of space here, but it still feels even, and still feels even through those shoulders and up through the weight of your head. From there, trying to maintain this the best you can. Start to peel your head out. Good. You did a really nice job organizing your shoulders. How's that feel through
Yeah.
the hips?
Stay the same.
And does that give you a little bit more core control?
Yeah.
Go ahead and start to lay your spine back down. That was nice. Okay? So we're, again, trying to maintain the organization of where your skeleton is,
Right.
but just start to work with that breath and with that movement to only add as much effort as you have to, not any more than you need to.
Okay.
So again, widening through those shoulders, elbows are going to float up. And so take an inhale. Remember we talked about exhaling giving us a little bit of flexion, inhaling giving us a little extension. So if we want to maintain this alignment, and then exhale as you curl up, feel how that helps to organize. And then inhale to lay the spine back onto the mat.
Yeah.
Does that help?
Mm-hmm.
All right. One more time. Exhaling, curling that spine, peeling it up as if it was a piece of tape. And you're doing a really nice job. I don't know whether the video can show this, but you're doing a nice job in organizing around those shoulders, segmentally peeling the piece of tape all the way back down through your head. Doesn't that feel nice?
Yeah.
Looks really good. Excellent. All right, so that's your neutral alignment with your head peeling up,
Okay.
okay? And then with your pelvis curling up. And those are going to be two things that we do in a lot of these exercises,
Okay.
okay? So let's change you up into a prone position, okay?
Okay.
And that's on your belly. And let's find where that neutral alignment is on your belly, all right? And I'm going to have you just rest your forehead on your, let's use you on your hands to
Okay.
begin with, okay? Because I just want you to kind of get a sense of what your breathing feels like in this position before we even start to move you. So some of the challenges with prone is we like to dump
Mm-hmm.
right through here. And if you have tight hip flexors, you might find that that's a little harder to have some neutral positioning between the pelvis,
Mm-hmm.
okay? And if your shoulders are tight or if your spine is tight and it's used to being in that flexed position,
Mm-hmm.
this feels a little awkward,
Mm-hmm.
okay? As you take an inhale and exhale, I want you to just feel what that feels like. Does that feel uncomfortable? Can you start to relax through that head, neck, and shoulders? Is there any discomfort in your low back?
Mm-mm.
Okay, good. So some things that might help with this position, if we think of lengthening the legs out of your pelvis, did you feel your belly just turn on ever so slightly?
Yeah.
Okay, and that's that neutral alignment of your pelvis that helps your transverse abdominis give you that supportive effort, but really not needing to do the work. It's just because it turns on. Lengthen through your left leg and even lift it up a little bit and just see if you have a little tightness on the front of that hip, and then lower it, and then do the same thing on this right leg And is there any difference between the length and stretch as you lift one leg versus the other leg up?
Mm-mm.
Okay, great. Okay. And so that's just going to give you a greater sense of knowing that both hip bones can rest heavy,
Mm-hmm.
and that lengthening of both legs is just giving you a little bit of core stability. Okay.
Okay.
I'm going to have you bring your hands back by your sides as if you were going to raise up into a push-up position. Yeah?
Okay.
And I'm just going to prop your forehead just so your nose can breathe. It's really technical. Okay. Does that help?
Mm-hmm.
Okay. So again, oftentimes we're in that forward flex position and our shoulders kind of want to,
Mm-hmm.
which we noticed when you were on your back.
Mm-hmm.
All right. So if you were to let those elbows kind of come up towards the ceiling, you can kind of feel how that
Mm-hmm.
facilitates that flexion in your spine. What we're trying to do is help your spine be in a more neutral position. And did you feel how that opened things up a little
Mm-hmm.
and gives you a little bit of support and work here?
Yeah.
Anything uncomfortable about that?
Mm-mm.
Okay. So what we're going to try to do, we're going to take this into an exercise, and Amber's doing a nice job of her head, neck, and shoulders being aligned. Her spine is in a good position. She doesn't have a lot of tightness through her hip flexors and not a lot of excessive tightness and gripping through this back. All right. So let's go ahead and take this into what we call a prone chest lift. So, and I might even bring your hands back just a little bit further. Good. And again, allowing those shoulders to roll forward. You can feel where they're not connected.
Mm-hmm.
And then as you draw those elbows back and connect them along the sides of your body,
Mm-hmm.
it almost gives an ease of your head being able to lift,
Yeah.
doesn't it?
Yeah.
No big deal.
Yeah.
So, inhale, go ahead and bring your head up just so that it's standing on the front of your ribs. Good. Any discomfort there?
Mm-mm.
Any compression here?
Mm-mm.
Excellent. And then let's just go ahead and let the chest roll forward and coming back down. So you did a really nice job of not getting an excessive cervical cervical extension
Mhm.
and flexing in that spine right
Mm-hmm.
through here, but rather getting a nice extension through the spine as you come up. And that's the goal of this.
Okay.
So as you inhale, lengthen your spine. Exhale, start to peel up. And you might feel some arm work. Inhale, take a breath here. Yes, and did you feel how you softened it?
Mm-hmm.
And then you could come right back down. Let the shoulders release a little. Let the elbows come back a little. And then we'll lift up through. Exhaling. Inhale here and let it come back down. And each time as you find ease in coming down, see if you can mimic that as you come back up. And let it breathe. Good. And I'm going to see if we bring those hands back just a little bit more. Take an inhale here. Exhale, drawing those shoulders back down and in. Letting your eyes float up. Letting the shoulders peel up. How you doing?
Good.
Did that help to shift the hands back a little bit?
Mm-hmm.
Good. So it just might give you a little bit more support. And it isn't about how high up, it's about where your spine is willing to move. Letting those shoulders roll back and down. Good. And roll forward through that breastbone. And peeling back up again. Allowing that lumbar not to need to have the compression, just standing on the front of the ribs. And then peeling back down. Good. And one more time, letting those shoulders and elbows reach back. Good. Eyes coming up past the front of the towel. And then rolling forward and down. How you doing?
Good. I can feel that.
Isn't that nice through there?
Yeah.
Come on back into a child's pose and let your low back just get a nice stretch. Good. So again, the tightness through the front of your shoulders,
Mm-hmm.
did that help to bring the elbows back?
Yes. Yeah.
Okay.
You can
And
feel
then using that assistance of your arms, gave that extension in your thoracic spine
Mm-hmm.
just to come into the ribs. And again, we were using your ribs on the front side to flex
Right.
and move. And now we use some extension to have those ribs get more connected in the back and opening up through the front of the rib cage. And that's what allowed you to have it, the weight of the ribs heavy,
Right.
still on the mat, but getting that little curve up
Right.
and away from it.
Right.
Okay? Without having to have compression down the spine.
Right.
Okay? And
That
that
makes sense.
breathing felt good?
Yes. Yeah.
Excellent. All right. So that's your prone press up and some work in that extension.
Okay.
So let's go ahead and have you lay on your side, and I'll have you face the camera.
Okay.
And in this position, I don't know about you, but I sometimes have a hard time kind of figuring out where my body is in space.
Yeah.
All right. So for where to position your arm, sometimes having your elbow bent underneath you, just as
Mhm.
it is fine.
Okay.
Another position might be to extend your arm out past you and just laying there. And you can decide what's more comfortable.
Okay.
And then if you were to think about lining up your spine with the edge of this mat, so you can kind of see right now your hips are further away than your head.
Mm-hmm.
So let's bring your head and shoulders back a little bit. Good. So then we have the same amount of distance from your head and chest as we do your hips and your pelvis.
Okay.
Okay? So that just kind of gives you a line.
Okay.
All right? And then the other piece that we're looking at is aligning vertically your hip bones and your shoulders. Okay? So if you were to think of that line on the back side of your body in conjunction with the line on the front side of your body, we're just trying to find center. So that gives you an awareness if you're rotating your shoulder or your
Right.
hips are a little forward, that awareness. We're just trying to organize, organize, and organize.
Okay.
Does that make sense?
Yeah.
Okay. Another thing that I sometimes ask people to be aware of is where you are having a little bit of tension. If you start to roll back towards the back edge of the mat,
Mm-hmm.
do you feel how you lose some of that supportive tension on the front of your body?
Yes.
Versus if you roll forward a little bit,
Right.
you can kind of feel that intra-abdominal pressure
Yes.
just kind of turn on a little and give you a hug
Right.
on the front side of your body, okay? And that's going to give you a little bit more anchoring as well, along with this hand, kind of the kickstand, so
Uh-huh.
to speak, all right? And you can use your palm all the way down if you need to just give you some nice stability,
Okay.
okay? Now sometimes, I don't know if in yoga, I know you do some yoga, they might talk about creating a space between your rib cage and your hip.
Mm-hmm.
And that is fine.
Mhm.
What I'm probably more concerned about is just having this hip stacked
Right.
versus trying to actually lift your ribs up. If you lift your ribs up and try to pull it off, you have other places that kind of tense.
Yes.
We're not trying to create that.
Right.
We're just trying to create a nice alignment where you have a good support to be in this side lying position.
Right.
Okay? So let's do an exercise here.
Okay.
All right, side lying is a alignment exercise for your spine, but it's also a hip movement. All right, and Amber, I'm going to give this to you. If that feels better.
Yep.
Does that feel good?
Mm-hmm.
Okay, and you can place your hand underneath the towel, however it's going to support your head the best. Okay,
Perfect.
so we're aligned here, we're aligned here, we're aligned here.
Okay.
All right. So if we were to just have you hover your ankle, knee to your hip, up just as high as this hip. So just the top leg.
Oh, just the top?
Yep.
Okay.
Okay, and then lower it right back down. So still maintaining, and I'm going to bring your head back just a little bit. Good. So your head, ribs, and hips are still in that good alignment,
Okay.
skeletal alignment, and still feeling that little bit of tension on the front of your body.
Mhm.
Good. Now just hover that top leg up. Good. You feel a little bit of work here.
Yes.
And lower your leg back down, and raise it right back up. Good. And down. and raising it up, and kind of feel how that turns on some work
Yes.
through your whole spine and core.
Mm-hmm.
We want that. That's a nice support, okay? So as we have some global movement going on, those deep core stabilizers get to just turn on automatically because we're in that good alignment. Does that make
Right.
sense?
Uh-huh.
Okay. So keep the leg raised and maintaining this 90-degree angle. I'm going to have you start to inhale and bring your foot back behind you. Yep. Exhale, bring that knee forward. Good. Inhale, take it back. And exhale, bring it forward. And we're just trying to maintain this good line of your ankle, knee, and hip in the same plane. And this is your walking,
Mm-hmm.
okay? And it just requires a little bit of extra stability and work. And you're doing a nice job of not flinging your hip and your spine in opposite directions.
Mm-hmm.
And keeping that nicely organized. You feel a little bit of glute and ham work back here.
Yes.
And good core support as you move through it. And one more, bringing it forward. And then lowering your leg down.
Yes, I feel that.
That was a nice job. So you kept really quiet through your upper body. Amber did a really nice job. She made it look pretty easy. Keeping that pelvis nice and easy. Keeping that upper body quiet so you weren't rolling back and forth. And having some nice stability through that sideline movement. And that's what we're trying to do whenever we
Okay.
do sideline work. Have good stability through the core to give us movement and range and ease
Okay.
of the other extremities that we're moving.
Right.
Okay? All right, let's change it up just a little bit, and I'm going to have you come into a seated position.
Okay.
All right? And so each of these positions, we're trying to find alignment and using your breath.
You want me to face that way?
Let's go ahead and have you face this way to begin with.
Okay.
All right? And if you want to just sit Indian style.
Okay.
So here is another alignment position that we sometimes kind of fight with,
Mm-hmm.
all right? And the goal is, again, to try to find that pelvis right below your rib cage with your head right on top of that, okay? And is there any discomfort in this position?
No.
Okay. So Amber has a pretty straight spine, all right? And I'm wondering if you bring your ribs back a little bit, okay, even a little bit more, and your head as well. Good. How does that feel?
Good.
So what changed?
I feel like I came back more over my sits bones
Good, good.
rather than almost having a little bit of sway in the thoracic.
Okay. And how did it feel in your spine?
Good. It's almost a little more relaxing.
Yeah. So when you were first started, there was a little bit of work going on
Yes.
in these back extensors. So even though you were in a seemingly neutral position, you actually had some of your back extensors working
Yes.
to try to fight you in that position.
Right.
Okay? Do you feel a little bit of core support here?
Yes.
Okay, so there's that transverse abdominis being
Yeah.
able to just turn on again
Right.
as we stack your skeleton up. Okay? How does it feel in terms of your neck and your shoulders?
Good.
Okay? So a little less fight with that
Mhm.
pull forward as well.
Right.
Okay? And so that alignment of your sits bones right underneath your pelvis, right underneath your rib cage with your head.
Mm-hmm.
And then let's just add a little of axial elongation. So if you feel it, yeah. Did you feel that nice little hug
Yes.
that you got? And I don't know, again, if you can see it in the video, but just muscularly, it's just like it got more streamlined and things just turned on.
Yes.
So that's really nice. Okay?
Yes.
And that's the position with your seated position with work we
Mm.
want to start and move from.
Oh yeah.
Okay? Feels pretty good,
Yeah.
doesn't it?
I'll have to
Okay.
remember that.
Okay? So again, finding your head and looking at you laterally, your ears lining up through the center of your shoulders. out through the center of your hip.
Uh-huh.
That's what we're looking for there. And when you started, those ears were maybe out here in front of your
Oh,
hip
right.
sockets instead of lined up through them.
Okay.
Does that make sense?
Yes. Yeah.
Okay, good. All right, so that's your seated position. Let's take it into a lateral flexion, okay? And so this is, I'm going to do a modified version, all right, keeping you in a Indian style versus a what we call a Z-sit
Okay.
position, all right? And what I'm going to have you do is face front
Okay.
and
Staying Indian.
Yep.
Sound.
looks good, all right? So again, let's try to find where your body, where your sits bones are first, good, and then where those ribs stack. Nice, good. How's that feel?
Good.
All right. So if we were to extend your arms out to the side, now in this engaged position, easy control through the shoulders, good. So all I made a little adjustment with your arms when they were back here. Did you feel how that kind of grabbed through your head, neck, and shoulders a bit versus just bringing them slightly forward to ease some of that tension?
Yes.
Okay. And again, that's going to be where tightness is and where you need to move in an easier way.
Right.
Okay. And do you still feel nice and strong through the center?
Yes.
So I'm going to have you take your left arm up towards the ceiling and your right arm down towards the floor. Still finding that nice alignment. Okay. So from here, we talked about breathing and how your exhaling and inhale can move your spine,
Mm-hmm.
but not need to necessarily change where your stability was coming from. So I'm going to have you inhale as you bring your hand over your head and your spine. Just start to move towards your right side. And do you feel that nice stretch?
Yes. That feels good.
And still settled on both hips.
Mm-hmm.
Good. So let's exhale, drawing those ribs right back on top of your sits bones to center. Good. Go ahead and take your left hand down, extending your right arm up, still finding that easeful alignment and length, and start to take your arm up and over. Good. Allowing that spine to get it opening on this side and a closing on this side. Exhale, bring your spine right back over on top of your pelvis and feel that control again.
Mm-hmm.
Lowering your right arm, taking your left arm up. Inhale up and over. So feel this opening. Still letting those shoulders rest. Good. And then exhale, drawing those ribs right back on top of your pelvis. Inhale, coming up and over. Feel that breath. Nice. Exhale, finding those ribs stacking on top of the hips. And last time, inhaling over. And nice correction. And exhale, coming back and over. How you doing?
Good. That feels good.
So did you feel how that breath could allow movement to open
Mm-hmm.
and give you stability to come back into center?
Yes.
That's part of that lateral flexion, because we want to be able to move to the side, but we also want to be able to find where center needs to come back to.
Right.
All right? All right, the last position I'm going to have you in is in a quadruped.
Okay.
All right, so go ahead and come onto your hands and knees. And with our hands and knees, what we're looking for is a vertical line from your wrists through your shoulders, and then from your kneecaps into your hip socket. So where I would suggest bringing this knee in a little bit closer.
Forward?
Yep, forward. Yep. A little bit more, a little bit more. Good. And is that easier?
Mm-hmm.
All right. So we're trying to find this really strong four-legged table,
Mm-hmm.
okay, to give an easy, strong place for your table to rest on,
Okay.
okay? So again, we've been talking about where your sits bones are in relation to your head, okay?
Mm-hmm.
And then we're also looking at the line of your hip to your knee and your shoulder to your wrist.
Okay.
Now, for some people, having your body's weight on your wrist is sometimes uncomfortable. And
Right.
so organizing even weight from the inside to the outside of your wrists, and then maybe drawing a little bit of suction. Yes.
Oh, yeah.
Did you feel how that
Yeah.
just gave you a little less tension in the joint itself and gave you a little bit more strength in your hands?
Yes.
Okay. The other thing that sometimes is a challenge is people like to lock out their elbows, and you're actually
Oh,
doing
yeah.
a really nice job. So when they hyperextend,
Oh, yeah.
and you see how that,
Mm-hmm.
a lot of people go there. You didn't. That was really nice. So having those elbows kind of have a flashlight out to the sides,
Uh-huh.
all right? And then as you draw your body's weight on top of that, keeping your body still in that wrist, I'm going to shift you forward ever so slightly. Good. And did you feel the support of the shoulders get a little bit more work on the back side versus tension on the front side?
Yeah.
So if you go back again, you feel how you have a little bit of fight going on here.
Yes.
Versus if you shift forward, you now got this whole shoulder girdle
Right.
to give you a little bit more help.
Right.
Okay? So your rib cage, again, we're trying to find the center of your head, rib cage, and your pelvis.
Okay.
So that's where that axial elongation, so we don't want to have the back popped up,
Okay.
but we don't want to have it collapse down.
Right.
You can see winging sometimes, all right? You know what I'm talking about?
Mm-hmm.
And if you think of widening through those shoulders and putting a little pressure into the floor,
Mm-hmm.
did you feel how you filled up that space?
Yes.
That looked really nice, okay? And does that feel comfortable on your shoulders and your wrists as well?
Uh-huh.
Okay. So, a nice natural curve and a natural curve again. Axial elongation from those sits bones to the crown of your head. And what we're going to do, we're going to try to maintain this positioning as you start to extend one arm forward. So you're going to have to recruit a little something different,
Yeah.
right?
Yes.
So we're going to take one arm up, bring it back down. Using your breath, take the arm up.
Same or different?
You can alternate and coming right back down. So inhale, take the arm up. That allows the spine to stay a little bit more stiff, right? And
Mhm.
stabilized so it doesn't collapse. Exhale, drawing it back down. Inhale, float it up. Exhale, bring it back down. Let's take it to the lower extremities. So maintaining that good organization with your upper body, maintaining that nice axial elongation, little hug around the spine,
Mhm.
so to speak. Start to just slide one foot back, and you don't even need to lift it up. And then slide that leg back down. Good. Inhale, start to slide your other leg back. Good. And do you feel that support with that
Uh-huh.
inhale? Exhale when you come back in, okay? Inhale, slide it away. And you can lift if it feels good. And bring it back in. And switching, inhale as you go back. Exhale as you come in, trying to maintain that support. So let's challenge you a little bit because you're doing a nice job.
Okay.
So we're going to use opposite hand to foot,
Okay.
okay? So stabilizing through the spine, organizing through your body, okay? A little stability through those lats. And I'm going to bring your shoulders back just a little bit. There you go. Did you feel how that
Mhm.
settled you? And I'm going to bring your body forward. There you go. And did you feel how that turned on your core a little?
Yes.
Okay? So maintaining this alignment, start to float an opposite hand to leg, and I don't care which one, whichever feels stronger. Exhale, bring it right back in. Good. And bring it right back in. Good. So let's imagine you have a tray of wine glasses that we do not want to spill, okay? So trying to keep this quiet as you move quietly away from your body. Exhale, bring it right back in. Good. And switching one last time. And bring it right back in. Nicely done, and come back into a child's pose.
Nice snap and crackle.
Nice work, Miss Amber.
Yay.
All right, I'm just going to turn off the video.
We didn't spill any